Alright, this is the finger X taping. Here we're going to use her pointer finger. And this is the PIP joint, DIP joint. We're working closely with the PIP joint and making sure that is kept normally. So you are going to want to start like this, and you want to come under and right over that PIP joint because you're wanting to stabilize it. But you want to come just proximal to the DIP joint so she can still bend her finger. You can use QDA, and you could use it with a small thing and just lightly with a cotton swab and lightly put it all over the finger. You don't want to obviously put it in the palm of the hand if it gets there, because that could be aggravating to the athlete. You want to do it bilaterally. And then you're going to do it twice. You can, depending on the size of the athlete's finger, you can overlap by half or a quarter or whatever needed. You're going to have to take a pretty steep angle. Then after those strips, you're going to want to put closure strips. And when doing the closure strips, you want to make sure it ends on the dorsal aspect of the finger. Same down at the bottom of the finger. And then you want to make sure at the end that this PIP joint is left open. You can see a little diamond kind of shape in it. You want to check for functionality. So can you bend your finger? How does it feel?
Good.
Too tight, too loose?
Just fine.
Okay. You want to document everything that you did, obviously. The type of tape that you used, if you use QDA. If you do not use QDA, you want to make sure the athlete or the patient has no allergies to anything. You would stop or discontinue this use if the DIP joint is feeling better, or the PIP joint, or if they have found like a custom-made kind of brace to put over their finger, or if this didn't work, you would then try something else. But that's about it. Alright.
Next, we're gonna apply the distal anger. I'm gonna say about the mid calf, mid belly of the leg. And once again, overlapping by about half. Then I will get my 3-inch elastic wrap and apply my anchors with it. So use moderate roll tension while going around. Then anchoring it, and that's on the leg. Continuing. Once again. As you can see up here, I did anchor this directly to the skin just for a better stick. Then I'll proceed to do the same distally. Apply anchor strips. Let's go ahead and put one more on down here. Make sure we get it low enough. So from here, next we are going to come around to the back of the leg.
Have your athlete face. Yeah.
And so we're going to take this and anchor it to the bottom. And then I'm going to stretch out the tape and see how, and go about 3/4 of the way and just of the stretch of it. And see where we're going to anchor it, and then come back. And I'll just cut the tape right here. Because you want to have high tension on this band so you can keep this knee from hyperextending. I will also go ahead at this point and take a heel and lace pad and anchor it to the tape to cover this popliteal space right here to keep irritation from occurring. And hold on, pause it right there. So now after we apply this first one, we're going to apply our next strip. So we're going to start on the medial aspect of the lower leg, and we're going to cross, and so you're going to anchor it there. We're going to, and we want to cross right at the popliteal fossa, and then anchor on the lateral side, and we want that to be about 3/4 tension. So I'm going to go ahead and measure it out, and bring it back into its normal state, and cut it. So now I'm going to apply it. I'll bring it across, anchoring it on the lateral side. We're going to do the same, but we're going to begin on the lateral side. Okay. I want to begin here on the lateral side. Measure it out, about 70%. Bring it back. Cut it. And then bring it up, anchoring it approximately across the space. We don't want any wrinkles here. So we can see how this is covering the popliteal fossa back here. And then we're going to go now and close it up. So applying closure distally and proximally. Also making sure that we don't roll too tight around the belly of the gastroc or the thigh, just so the hamstrings, the quads, and all the lower leg muscles don't become too constricted from the tape being too tight. And there you go. And now I'm going to ask the athlete how it feels. So how's this feel?
Feels good.
Can you try extending your leg a bit? You feel like you can extend it? No. Not any pain with that motion?
No.
I'll ask the athletes maybe just some light running, walking around, see how that feels with the extension. We're going to document what we used and how we used it, and see how it worked out in the end. Also, for discontinuation of this, if his symptoms improve and after a few days or weeks of using this, he feels like we don't need it anymore and we can work without it, then we'll try not using it. Or if it does not improve, we need to try another technique, maybe a more rigid design, a brace, or removing him from play while he recovers. This taping technique is the medial tibial stress syndrome taping technique, or the MTSS taping. This is usually used to help with shin splints, and so we're going to start applying our pre-wrap. So we're going to apply it to cover the whole area, starting just inferior to the knee, overlapping by half as we come down and around. This can be applied without pre-wrap for females or individuals without much leg hair, but usually it is encouraged to use. Also, we can apply QDA below this, if we would like to keep it stick better, and if the patient does not have a latex allergy. Once you apply the pre-wrap, we're gonna apply our anchors. So I'm gonna apply 2 proximal and 2 distal anchors, making sure that I don't put them too tight around the belly of the gastroc, or else with motion and moving, it might impede the gastroc to expand and hurt and therefore injure our athlete. We're also going to put 2 distal anchors. These are going to be just superior to the malleoli. And finally, we're going to apply a medial and a lateral longitudinal anchor going between our proximal and distal anchors. Once we get all those down, we're gonna start with our strips across. So we're gonna alternate. So we're gonna start from going up and going back down, making sure we always go lateral to medial when lying the tape. So we're gonna anchor on the lateral longitudinal anchor, and we're gonna pull across and insert it on the medial longitudinal anchor, making sure we get a nice tight pull. And our first one's gonna go aim up. Our next one is gonna go and aim inferiorly. So anchor it on the lateral longitudinal, put it on the medial one. Then we're gonna repeat. So overlapping by half, going up. We're going to be making sure that we don't leave any holes in the tape, because that could cause friction and irritation to the athlete, and that wouldn't be good. Alright, once we finish that, we want to put another anchor down the medial and lateral sides. And once we do that, we'll check, make sure it's nice and tight. We'll ask the athlete to perform some functions. So first of all, how does it feel? Fine. And then we can, if we would like, we could ask the athlete to perform certain things, such as running or jumping or cutting, and just see how he feels with his shin splints. Make sure that our anchors are just not too tight, and we also want to make sure we close up our top and bottom anchors. Instead of closing up with the non-elastic tape, you can also close up with a PowerFlex tape, and you can with the PowerFlex you can go all the way around and up.
Pattern.
And if you note the pattern of it, it's a crisscross X down the center. You can see how they overlap, and you want to try to get that to be standard down. And we would discontinue the use of this method if the athlete feels like that he has more strength in his tibia and the pain's going away. We try to practice without it, see how he feels. Or the alternate, if it's not really helping at all and we need to try another means, which might just be rest and sitting out if it's a bad case of medial tibial stress syndrome, because that is the best way to heal it, is just rest and time.